Hi everyone, my name's Dr Leanne Kenway and I am Senior Lecturer of Anatomy and Physiology in the School of Medical Science. So I've been asked today to have a little chat with you about a few different things that have happened over my career as an academic here at Griffith University, how maybe I got here in the first place, what I did before that, and some of my general interests otherwise. So I mentioned my current role is Senior Lecturer of Anatomy and Physiology. I work in the School of Medical Science and I've had this particular role for since 2016. I went on staff to set up two mixed mode intensive courses that are delivered to all the foundation year health students. So that's what I've been doing in T2 and T3 for the last few years. This particular course has been well established in its didactic format in T1 for a number of years, and this was to bring an alternate mode or offering for students to study with some flexibility in terms of watching their lectures ahead of time, and also the intensive nature of the course, offering it as some academic recovery for some students as well. So yes, love being in my anatomy lab teaching. What do I enjoy most about teaching undergraduate courses? So these courses are first year courses, so foundation courses of anatomy across all the health programs that we offer here in Griffith Health. And I enjoy most, particularly my students. I love seeing the enthusiasm and the passion that develops in them for learning and becoming a habit of lifelong learning, and in particular to see their enthusiasm for anatomy, of course. So yes, I get to teach in labs, I get to teach online now as well, with our new approach to learning at Griffith becoming more blended, online classes in addition to our on-campus practicum sessions in our G40 facility and tutorial classes. So there's my buddy, muscle man, and myself up in the G40 facility. What uncovered my passion to follow a pathway towards teaching? For me, it was a little bit of a surprise venture because I didn't start out in education or as an academic. The first career that I had was as a physiotherapist. So I guess I've always had some element of education in that I've educated my patients with different exercises. I've educated other physiotherapists in terms of our professional development and in-services that are provided within practices and hospitals that we worked within. And it became a natural progression then that once I returned to uni to see what it was that I really wanted to pursue in the area of health, that teaching definitely became a passion of mine under the motivation and the encouragement of some beautiful mentors and conveners of courses here at Griffith. So I think the timing of the opportunities that came available that I had, the supportive mentors and staff who are now my colleagues here at Griffith, support from students who as peers and then as my students as I was a tutor to them really encouraged me that in fact teaching was where my strengths lay and that I should pursue a career in academia. So a very different I guess introduction than maybe a lot of the other academics have had. Making the most of opportunities that have been provided, saying yes to a lot of things, probably in some cases too many things, but it's taking on those opportunities and being brave about taking on those opportunities, even if they fall out of your comfort zone. It's really important. Yeah. So you want to step into that courage zone, which doesn't always feel good or comfortable, but that's where most of the learning and the gains occur. So I think I felt like I was on a roundabout. There were a lot when I came to Griffith to see what I wanted to do. There appeared to be a number of exits. There were some very exciting exits, but I could also get back on and sort of see where I really wanted to end up. And I feel like I have taken the correct exit for me working in the school of, currently named the School of Medical Sciences, as an anatomy and physiology lecturer. Where did I complete my tertiary education, and what do you remember most about your experience at university? So my undergraduate degree was a Bachelor of Physiotherapy with honours that I completed at the University of Queensland in Brisbane a few decades ago. And I think probably the thing I can remember most about my time at UQ was most definitely the friendships that I made with the rest of my cohort, but I also lived on campus. So I had that experience of living with a group of uni students who were all first, second or third years across a number of different degree programs, some taking my same courses, some from very different fields and very different parts at that point of Queensland. So I've made some lifelong friends through, I guess, similar interest areas, but also been thrown into that situation of where everyone is feeling a little lost and uncomfortable to start with. So making my friends, and those friends have been friends for life. I'm still in contact with so many of them these days, which is fantastic. And my second tertiary degree has been my Doctor of Philosophy that I gained here at Griffith University, followed by a graduate certificate in higher education here at Griffith. And so I think older, hopefully a little wiser since then. I came to Griffith as a mature age student. I'd been working as a clinical physiotherapist for some years, and I suspect my organisation and planning was quite different as a student this time. Obviously, an undergraduate and a postgraduate degree are completely different in terms of having to drive your own learning more significantly in a postgraduate degree, making some good decisions. And so the connections that I've made are probably the most memorable part of that transition. And so the fellow students that I've completed my PhD with are still good friends of mine, and now my colleagues that I work with, that I have some wonderful working relationships with. So what inspired me to select those undergraduate and postgraduate degrees that I studied? So initially, as a physiotherapist, I was just interested in working in health. I didn't know specifically that it was physiotherapy that I wanted to be involved in. It could have been medicine, pharmacy or dentistry. They were all on my list of interest. But once I got into the physiotherapy program, I really enjoyed the connections that I made with my cohort and the difference that I could make to patients across a vast, a really broad spectrum of type of patient, and working within the health industry. So I knew at high school I just wanted to make a difference, and I wanted it to be in health, and that's where I started out. In terms of my postgraduate degree, it was much later. In fact, when I first arrived at Griffith, I wasn't sure that I even wanted to pursue a PhD, but that was made clear that it should be in my line of thought as I tested the waters on studying a few extra subjects to see if I could still study as a mature age student, how I would go. And I really had always had a love for anatomy and neuroscience. And so that's what led me to choose a PhD in the School of Allied Health Sciences, looking at physiological tremor. So the neuroscience or the neuro and biology underlying those movement interactions between two hands. So have I worked outside the world of academia? Yes, I have. That has been one of the benefits of having my physiotherapy degree and profession. I have worked in Brisbane, in Queensland at the Royal Brisbane Hospital, Royal Children's Hospital and Royal Women's Hospital for a number of years before I moved to the United States to work as a physical therapist for 3 years. And then after that, returning to Australia, ready to start my family, my husband and I work in private practice here on the Gold Coast. So I've had a number of different experiences, both in hospital, within the Queensland health sector, as well as in private practice and in community work too, aged care. as a private or solo therapist. So quite a large spectrum from that clinical perspective. And I think that really brings something unique for me to offer my anatomy students that has that authentic experience that they can gain through my lens as a physiotherapist. And then my PhD, as I mentioned, Doctor of Philosophy, was looking at tremor between two hands and the amount that tremor might increase when one hand starts to exert greater forces. And we then also start to play around with visual feedback and how that has increases in tremor in certain hands. So yeah, that's been kind of a little bit of a variety, but always in really interested in health and anatomy and neuroanatomy in particular. So my PhD was completed here in 2015 at Griffith University. I had the opportunity to present my research at a couple of conferences. My paper was also presented in Italy at a conference, and they're my lovely supervisors that I have a lot of gratitude for helping guide me through that 4-year experience here at Griffith, and for assisting me in keeping on target to finish on time while I still worked as a physio 1 day a week, and then also raising my family with 2 teenagers at that point. I had the opportunity to complete the 3-minute thesis 1 year and was named the winner in the health group. So that was kind of fun, having that little bit of a competition edge to what would normally be a research-based activity. I've just kind of posted an undergraduate and postgraduate timeline to show you kind of where I went from, in the grey sections on top, my Bachelor of Physiotherapy with honours at UQ, and the different places that I've worked across Queensland and the United States, in central Illinois, and then back to the Gold Coast, where I love to call home. And then on the bottom there in the red is my time at Griffith. So I arrived at Griffith in 2008 as a miscellaneous student. I took a couple of subjects, Anatomy and Physiology 1 and 2, because I just wanted to see how I'd still go studying. I wasn't so sure that, I was capable of it. But I think my experience can probably show you it doesn't matter how little confidence you have in yourself, being around the right people with the right support and taking the opportunities that are afforded you can end in wonderful places. So it's a really nice support mechanism here at Griffith. I completed a few other studies. I was invited to tutor in each of those courses along the way, and then encouraged to complete my PhD. So while I still worked as a clinical physiotherapist during this time, I was able to complete my PhD in 2015. I completed some research assistant work over that year, and then the following year this role for me came available in 2016, where I was employed as a lecturer. In 2019, I received my promotion to senior lecturer and also completed my graduate certificate in higher education in that year. So yes, lots of wonderful support to get me to that point here at Griffith. So what has changed most about the undergraduate experience when I completed it, and what about now? Definitely technology. It was much like the dark ages when I completed my undergraduate degree in physiotherapy. So we turned up to lectures in a very big lecture hall. We frantically wrote notes and gathered in groups afterwards to see if we could find those gaps in those notes and filled in the gaps. And then we photocopied everybody's lecture notes and then had a nice set that a number of us could study from. The amount of resources, the sheer volume of resources that are available now, and the technologies to make use of those resources easier, more flexible, it's sustainable, it's time-saving. It may not be time-saving in production of it, but it's most certainly time-saving for students in terms of retrieving it. So I think that's a real huge positive for the way undergraduate courses are designed these days, with a mixture of that personal in-person or face-to-face contact and connection with your lecturers and tutors and peers, but also having the availability of these online resources that can be uploaded. You can watch your lectures at a time that suits you, around your work, your sporting commitments. That certainly wasn't available when I was an undergraduate, so that's really lovely. One of the projects that I've been involved in with a wonderful colleague of mine, Dr Abdullah Karaksha, who teaches chemistry for the Foundation Year Health, was to design an online learning tool to assist my anatomy students with the study of the nervous system, and in particular the brain. And we were able to collaborate with the School of Pharmacy and utilise some equipment that allowed us to take these fabulous images of our cadaveric specimens and then produce some learning activities, quizzes to help with revision of the content prior to exams, as well as these videos that were created from the stitching of 72 images of each of these brains. So students were able to access these via their course site and then utilise them for revision outside the laboratory. Due to the increase in number of students enrolled, of course, we don't have that same access to the space more than just in that allocated practical session when we're viewing wet specimens. So this has been a really nice additional tool for students to be able to use. So just one example of some things that we're doing on campus here in projects to assist our student learning. What turning points were there throughout my career that have led to me to achieve what I have achieved? The support that I've had from my colleagues has been instrumental. So it's the teamwork. I work within a large group in the Foundation Year Health in the School of Medical Science that feeds into a lot of programs across the other schools in Griffith Health. And I've made some wonderful friends who are very supportive and like-minded in their keen support of their students. So I was able to go to Melbourne to present some of this material that we've been developing as this project with my colleagues, and the Foundation Year were in fact recognised in 2019 with this highly commended certificate in terms of their programs and teaching award for the excellent outcomes that we've had with this Foundation Year remodel. Further to that, I've been exceptionally fortunate. In 2019, I was awarded the Griffith University Vice-Chancellor's Teacher of the Year Award by Professor Carolyn Evans, our Vice-Chancellor, and that was a real highlight of my career over this last decade. I would never in a million years have imagined this would be possible or even thinkable. So I encourage you to be brave and take those steps, because you never know what can happen at the end of a period of time. It's certainly not the end of my pathway. I'm planning to be here for a while yet. And this year, I've just this last week received the very exciting news that I have been awarded an Australian Award for University Teaching, one of the 2020 citations for outstanding contribution to student learning. So I'm very, very humbled by that indeed. Yeah, so it's nice to be recognised, although that is not the intent of my teaching here at Griffith. It has certainly been a motivator that I'm on the right path, that I did choose that correct exit off my roundabout and to come to Griffith. A couple of little things. What do I do outside my teaching? I love my family dearly. My dogs and birds at home have a lot of attention. Before children, we used to travel a lot. We've started to try travelling a little bit more again now with the kids, and now that they've grown up and they're at uni age now. My work has enabled me to travel to China to teach, where I was actually able to meet one of the past Beijing Olympic gymnasts and watch him train the future Olympic gymnasts in their gymnasium. I like to volunteer my time. So in 2018, at the Commonwealth Games that were held here on the Gold Coast, I was one of the costume creators and spent a lot of time sewing costumes for the opening and closing ceremonies. So a few little things that I do in my spare time, I guess. And lastly, the question that I wanted to answer for you: many students at university are yet to discover their passion and what they would like to pursue as a career. So what's my advice to those students to ensure they get the most out of the university experience? It's a really good question, and it's okay to not know upfront. So keep an open mind. You may end up somewhere you didn't expect. There is no way when I was 17 I ever imagined myself as a career academic teaching at a university level. So you never know what is waiting ahead of you if you keep an open mind. Attend a wide spectrum of events, because that's where you can meet people who have different ideas, different experiences, and there might just be something that triggers you then to know that that's in fact the profession that you are best suited for. Make friends, build a network. So friends amongst your peers, but also a network professionally, as well as for in your downtime too. Listen to advice from mentors. None of us have all the answers to start with, and in fact you can build on that advice and start to pull that advice and really learn from others' experiences, others who have been through the trial and error of the process. Ask questions. If you want to know, somebody might have that answer. Accept the opportunities as they arise and just keep learning. Learning should be a lifelong event, and I definitely will support that and hope that I can continue my learning throughout life here at Griffith University. Thanks for listening.